Well, it is the season for allergies, and you may notice they are getting worse. Harvard School of Public Health recently published a paper about how climate change means pollen is growing earlier in the year. And joining us now is Dr. Kevin Koo, a primary care physician with the Advocate Medical Group. Doctor, thanks for being with us. We'll get to the climate change aspect in a minute, but first, bring us here. It's a regional issue, I know, but how does this allergy season compare to years past?
I have definitely, seen a lot more patients complaining about allergy symptoms, the runny nose, the itchy eyes, and it just seems to be every year is getting worse. And so definitely, according to, the paper that came out and the other research that's coming out, definitely follows that trend where every year it just seems to get worse and worse for everybody.
Some believe that it came a little bit later in the season here, but how does the temperature swings that we've been having really wreak havoc on our noses right now?
So when the warmer weather comes about, whether you have that, the spikes that we had earlier, that especially nowadays, it's the trees that are releasing the pollen. So that warmer weather pushes that pollen out from the trees, and that's where you get those bursts of increased pollen, which then triggers the symptoms that people are experiencing.
Okay, so warmer weather, that's what comes along with climate change. So tell us what the studies that you're referring to have revealed about, where we go from here and what are some good ways to treat it?
I think the biggest thing in general, regardless of the studies or not, is really about prevention and kind of preparing yourself. As an allergy sufferer myself, I know firsthand that this is very frustrating. It can be very hard to get behind the eight ball in terms of dealing with the allergies. So first thing is knowing what your triggers are, trying to prevent yourself from being triggered by those allergens, whether it's pollen, mold, dust, so on and so forth. For the next, in terms of being prepared, is trying to plan, your exposure. So avoiding going out when the pollen counts are high, going out during the evenings when pollen counts tend to be lower, closing your windows when you're at home or driving in your car. Just reducing the exposures really helps kind of preventing those triggers to get to your system. So that's biggest. I think that's the biggest key.
Well, you have to know what you're allergic to, right? Does that start with the traditional pinpricks across your arm or back to know what is really a hazard for you?
It can. I mean, and that's, where like a specialist, like an allergist, really comes into play. Although I want to say that always starting out with your primary care doctor is important. Through Advocate, we have this patient portal called Livewell app. It's really convenient where you can just message your provider. So that's usually why I recommend, like, once you exhaust all your, over-the-counter medications, the nasal sprays, which are really helpful to reduce the runny nose and so forth, or the oral antihistamines to kind of reduce your immune system's reaction to the allergens. Kind of once you exhaust all those things, messaging or contacting your primary care doctor would be the good first step to see if there's anything that we can prescribe before getting to that point where you have to do the pinprick testing.
Yeah, for so many people, the end of the spring allergy season can't come soon enough before the fall one comes on. Dr. Kevin Koo, thanks for being with us tonight. We appreciate it.
I appreciate it. My pleasure. Thank you.
Okay.